Hi, good morning, Holland. My name is Mihiraa. Let's start the warm-up session. Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here, nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in the past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating and am equally comfortable working alone.
Your preparation time is over. You can now start your role play.
Hello, Mihiraa. Thank you for coming in so quickly. I understand this must be a worrying time for you. Please, have a seat. My name is Holland Hemsworth, and I'm the nurse who was caring for your mother this morning. I've asked to speak with you privately to give you a full update on what happened, so you have a clear picture of her condition and the care we are providing. To start, I want to check in with you first. How are you feeling right now, and what immediate concerns do you have about your mother after hearing she had a fall?
Oh, Holland, I was so frightened when I got the call. My first thought was, is she in a lot of pain? And I'm worried she might have hit her head. She's 84, and her bones are so fragile. I just need to know if she's seriously hurt.
I completely understand why you would be frightened, Mihiraa, and those are very natural and valid concerns. Let me put your mind at ease as I give you a full update. Your mother is currently alert and resting comfortably in her bed. She is not in any severe pain, and she was able to tell me her name and where she was immediately after the fall. She has a small, mild bruise developing on her upper arm where she may have bumped the bedside table, but that is the only visible mark. The fall itself was a minor one. She slipped from a standing position and was able to catch herself partially on the bed, so she didn't fall directly to the floor with full force. She is stable, comfortable, and we are keeping a close eye on her.
That's a relief to hear she's resting. But what about the checks you did? Did you examine her properly? I'm still worried about her head and if anything is broken.
Yes, Mihiraa, I performed a full physical assessment straight after the incident, so let me walk you through those findings in detail. I checked her arms, legs, and hips for any signs of fractures or swelling, and there was no deformity, no grating of bones, and she was able to move all her limbs without any sharp pain, which is a very good sign. She does have a very minor skin tear, about the size of a small scratch, on her elbow, but there is no active bleeding. Her vital signs, including her blood pressure and heart rate, are all stable and within her normal range. Most importantly, I completed a full neurological check. I examined her pupils, her level of consciousness, and her ability to follow commands, and everything was completely normal. There is no sign of a head injury or any confusion.
Okay, that sounds reassuring. But how did this happen? She's usually so careful with her walker. Was there something on the floor? Did she get dizzy?
Those are excellent questions, and we have looked into the possible causes carefully. From what your mother told me and what we observed, Mihiraa, the fall seems to have been caused by a combination of a few small factors. She mentioned she needed to use the bathroom quite urgently and got up from her chair a little too quickly, which caused a momentary loss of balance. We also noticed that the socks she was wearing were a little slippery on the wooden floor in her room, and her walking frame was just slightly out of easy reach when she stood up. There were no obvious trip hazards like rugs or clutter, so we believe it was more about the rush and the slippery footwear rather than anything in her environment.
I see. That makes sense. So, what happens now? What are you doing for her right now, and is she going to see a doctor? I want to make sure she's getting everything she needs.
Mihiraa, let me explain our immediate and ongoing management plan step by step. First, we have already cleaned the minor skin tear on her elbow with sterile saline and applied a small dressing to protect it. We will change that dressing daily and monitor it for any signs of redness or infection. Second, because any fall can have delayed effects, we are starting a 24-hour neurological observation protocol, which means a nurse will check her level of consciousness, pupils, and balance every hour, and we will document these checks carefully. Third, I have already scheduled a doctor's review for later this afternoon, so the doctor can assess her thoroughly and confirm our findings. And fourth, if she experiences any discomfort or mild pain from the bruise or the skin tear, we will administer mild pain relief, such as paracetamol, as needed, but she is comfortable at the moment and hasn't requested any.
Thank you for being so thorough. I feel better knowing the plan. But I'm still worried about this happening again. She's getting older and more unsteady. What can you do to prevent another fall?
That is a very important concern, and I want to reassure you about the fall prevention strategies we will be putting in place immediately. First, Our physiotherapist will come and reassess her mobility and balance within the next day, and they may suggest some gentle exercises to strengthen her legs. Second, we are going to install a bedside sensor mat that will alert us if she tries to get out of bed without assistance, so we can reach her quickly. Third, we will increase our regular welfare checks, meaning a staff member will pop in to see her every hour, especially during the time she usually gets up. And finally, we will review her footwear and mobility aid with her. We will encourage non-slip slippers and ensure her walking frame is always positioned within easy reach right by her chair and bed. All of these steps are designed to keep her safe.
That all sounds very sensible. I feel much more reassured now. Thank you.
You are most welcome. Just to summarize everything we've discussed for clarity, your mother is resting comfortably and is fully alert, with only a minor bruise and a small skin tear on her arm. Our physical and neurological checks were all normal, and we believe the fall was due to a quick rush to the bathroom and slippery socks, with no serious injury. Our management plan includes cleaning and dressing the skin tear, hourly neurological checks for 24 hours, a doctor's review today, and pain relief if needed. For prevention, we will reassess her mobility, install a sensor mat, increase our checks, and review her footwear and frame placement. Please know you can call us anytime for an update, and we will keep you fully informed after the doctor's visit. Thank you.